I would like to welcome everyone to today's Office Hours webinar, Creative Ways to Fund Your Schwartz Center Membership. I'm Kim Kenya Valancourt, webinar producer for the Schwartz Center for Compassionate Healthcare. I'm standing in for Stephanie Yuan today as your moderator. The Schwartz Center for Compassionate Healthcare is a national leader in the movement to make compassion a vital element in every patient-caregiver interaction, and we are pleased to offer this complimentary session to members and prospective members of the Schwartz Center. Before we begin the formal presentation, I'd like to go over a few details about the webinar. Today's program will be 60 minutes. The first 45 minutes will be presentation, followed by a 10-minute question and answer session. Today's program is being recorded and will be available on the Schwartz Center website 2 weeks after the session. Please note that attendees are participating in listen-only mode, but can interact with the speakers and me by using the questions pane, which should be appearing on your screen. If you have questions, please just type them into the questions pane and send them to us, and we will just address as many of them as we can at the end of the formal presentation. Finally, upon exiting the webinar, you will receive an electronic survey that we ask you to take a minute to complete so that we may capture your assessment of today's program. Your feedback is very important to us. And now it's my pleasure to introduce today's speakers. Lisa Crane is Director of Individual and Foundation Giving at the Schwartz Center. She's devoted most of her career to nonprofit fundraising, first in grant writing and now in a combination role of grant writing and individual giving through annual appeals, cultivation events, and major donors. For many years, she worked on behalf of at-risk children and families, and for the past 5 years at the Schwartz Center on behalf of patients and multidisciplinary clinicians. Welcome, Lisa.
Thanks, Kim. I'm very happy to be joining you today.
Our guest speaker today is Louisa Nedkoff, Manager of Kilo Employee Wellness Program at Halton Healthcare in Toronto, Ontario, one of the newer members of the Schwartz Center community. Louisa oversees a robust portfolio of innovative employee wellness programs, including fitness facilities, a beloved massage program, and Tea for the Soul that serve more than 4,000 Halton Healthcare staff. Welcome, Louisa.
Thank you, Kim. I'm really looking forward to today's discussion.
Well, we have a lot to cover today, so I'm going to turn our program over to Lisa.
Thanks again, Kim. Today, we're going to be talking about opportunities for helping to secure funds for membership, because we have heard over the years since becoming a membership organization that sometimes that's a challenge. So I'm so glad that you're here with us today, and I'm hoping that we can provide some insight and guidance for you. So let's start by reviewing what we're going to cover today. The first topic is going to be seeing the opportunity for fundraising for your Schwartz Center membership and not the burden. I completely understand that fundraising can be scary for people who aren't in the profession, and frankly, even for people who are. But it's my life, but I know that it's not necessarily your life. So I will walk you through looking at how this could be an opportunity for your organization. Secondly, we'll talk about building a relationship with your fundraising, marketing, or even your public affairs colleagues. Fundraising for Schwartz Center membership is a great way to work together with colleagues in your organization that you may not normally interact with often. Next, we'll talk about how to think about possible donors, how to strategize with your fundraising colleagues on who those people might be. Fourth, we will discuss thanking donors who have underwritten the membership for your organization. Thanking, as you will hear, is just as important, if not more important, than making the ask. Fifth, we'll talk about the costs of membership and discuss how to put together a comprehensive budget to present to donors. And finally, we'll share some case studies on what has worked in other institutions, including Louisa's Halton Healthcare. So let's come back to the first topic, seeing the opportunity for Schwartz Center membership as a fundraising opportunity and not a burden. As you'll see here on the screen, you'll see a teamwork image, and that's because, as you all know well, it's imperative to remember that in any institution, teamwork is paramount. I'm sure that you all understand that because healthcare is delivered through care teams increasingly these days. And Schwartz Center membership really is a tremendous opportunity for your fundraising colleagues, and that's what I want to help you see today. You have an opportunity for your fundraising team. Fundraisers are always seeking very specific projects to raise money for. Some donors give unrestricted funds to your institution. Here's, $1,000 that they respond with by getting a letter in the mail to use in whatever way the organization needs. But more often than not, donors are looking for specific needs that they can get their head around and their heart around. Schwartz Center membership is actually an opportunity to help your fundraising colleagues raise more money. Us fundraisers need a hook to grab a donor's head and heart, and Schwartz Center membership is a very compelling hook. Many donors understand what you as healthcare providers, healthcare administrators understand, that it simply makes sense for providers and caregivers in an institution to have a shared, sacred space to receive support from one another and to get re-energized from one another. And frankly, that as a potential patient at your institution, the donor would be better served by caregivers who receive emotional and psychosocial support from their institutions through programs like Schwartz Rounds and the other programs that we offer. So let's talk about how these opportunities and ideas can translate into donations. This is my realm, but not necessarily yours. So let's talk through them. Your idea, as I've mentioned, around Schwartz Center membership can raise more money for your organization. You have an opportunity to offer an invaluable tool to your colleagues that they're going to be excited about, and they'll be excited to hear from you. Fundraisers are always looking for new projects, so to speak, to put in front of donors, something exciting and something that tugs at the heartstrings. So this gets us to the second topic and the next question. How do you go about building a relationship with your fundraisers? Keep in mind that you each have a piece of the puzzle and you can help each other out. Your piece is a really valuable program to pitch, and their piece is they know how to fundraise and try to find money to support that program. So to get this off the ground, one of the first things you need to think about is to identify the right fundraiser in your institution to talk to. Maybe you already have a relationship with someone in that department, and if so, terrific. Start there, and if that person's not the right person, I'm sure they'll direct you in the right direction. But if you don't already have a relationship with someone in your development or fundraising department, then start with someone who has a title like Director of Development. Depending on the size of your organization, that person may go by other titles. They may also go by Vice President of Advancement or Chief Development Officer. But that said, if you do reach out and find that that person is hard to reach, which don't be discouraged, it's not uncommon. Those people are often out in the field meeting with donors and not at their desk very much, then reach out to someone who has a title like a Major Gifts Officer. That's someone who is particularly responsible for reaching out to individual donors at larger gift levels, often $5,000 or $10,000 and above. But for very large academic medical institutions, they may work exclusively with donors who give $100,000 and above. But in any event, both Major Gift Officers and Chief Development Officers are responsible for building relationships with donors and thinking about special projects that will engage them in the institution's mission. Then your task is to educate that person on what the Schwartz Center and the rounds are, how it has, or if you're not a member yet, how it could make a difference to you as an individual and to the institution. Channel the emotional connection you have to the program to inspire the fundraiser. Why are you passionate about the Schwartz Center? Why are you choosing to devote your time to it? And I want to offer a couple of ideas for conveying your enthusiasm and for getting your fundraisers on board. First is that you could include the fundraisers on your rounds email distribution list so that they get it monthly or bi-monthly, however often you host the program, and they can see what's going on and who the planning committee members are and what some ideas of topics are that you all cover. And secondly, I would really encourage you to take that a step further and actually invite the fundraisers to a session. You certainly could assure the participants that everyone maintains confidentiality, including non-clinicians. I myself have attended several rounds sessions, and I've brought outside guests, and I've never had a problem as long as I requested a visit in advance and to make sure that everybody is on the same page. And I want to offer, if you're a prospective Schwartz Center member listening to this and you don't yet run the rounds, please feel free to contact me and I will help find a rounds program near you for you and your fundraising colleagues to visit and observe. We do this all the time and I'm happy to facilitate that. I am very confident that if you can get your fundraising colleague to a session, they will be wowed by the program and sold on its value. So once you've built that relationship, let's think about the third topic, possible donors for this cause. Of course, your job is not to own those relationships. That is the fundraiser's job. But anyone involved with the Schwartz rounds has some interaction with grateful patients or clinicians. And that's a really good place to start when thinking about possible donors. So let's talk through these three examples that I have here on screen that you can discuss with your fundraising colleague. The first and second, Mrs. Smith once made me promise that if there was anything she could do to help, that I should ask her. As a clinician, these types of conversations probably come back to you. This is a great time to share those conversations with your fundraising colleague. Second, one of the hospital trustees shows up to Schwartz rounds every month. Many times I see tears in her eyes. Maybe she could help us think about possible donors. For current Schwartz Center members, this can be a common occurrence. Trustees often become so inspired by the program that they do attend regularly. So I would encourage you to speak with your fundraising colleague and perhaps reach out to that person and ask if they'd be willing to sit down with you both and brainstorm about people they may know who could become interested in support Schwartz Center membership with a gift to your organization. And third, Dr. Rosen was always passionate about patient-centered care. I heard his family is looking for a way to memorialize or honor his involvement at the hospital. You know, you may think that as a clinician, you give your heart and soul, and your first thought isn't to give financially as well. But there are actually clinicians who do support their institutions financially, and there also are other patients, family members, and friends who may be looking for special ways to honor that clinician. You know, we have people who give to the Schwartz Center directly in honor or in memory of a clinician because they are so impressed by the care they received. And it doesn't have to be someone who's involved with the hospital currently. Maybe someone who is very involved but has passed away, and friends or family are looking for a way to memorialize his work. So you and your fundraising colleague can also think about institutions that might be able to help. For example, many of us buy our lunches at the deli across the street. Maybe they would consider donating pasta salad and sandwiches for the lunches. Or our food service might be interested in making a donation of the food for each session, breakfast or lunch. Talk to your fundraising colleague about inspiring these kinds of businesses to consider donating the drinks, the salads, or sandwiches to your monthly food needs. That would go a long way towards helping cut down the cost of membership. Or companies interested in quality and safety initiatives are often interested when they learn about Schwartz rounds. There are companies out there specifically interested in these topics. And if you can describe how the Schwartz Center impacts patient quality and safety, your fundraising colleague can use that for an approach. It may not be something you think about very often, but it may just be the hook necessary for a business to consider underwriting the Schwartz Center membership. We here at the Schwartz Center main office have materials that can help your fundraisers make the case about how employee experience is impacted by the Schwartz rounds, and also how employee experience really drives patient experience. So please don't hesitate to reach out and ask for them. Now, let's switch from discussing how to raise money and from whom to the end of the process and how to thank donors who do step up, because thanking well is one of the best ways to ensure that the donor wants to give again. The Schwartz Center brand is highly regarded. Donors like knowing they're affiliated with your local institution, of course, but they also get a sense of pride from being affiliated with a national and frankly an international organization like the Schwartz Center. So the rounds session itself can offer an opportunity to thank your donors. There are many ways that you could go about doing this. I have a few ideas here. The first would be wording at the bottom of your promotional materials and connecting the donor with the Schwartz Center brand. For example, when you're advertising the next session, the Schwartz round is made possible by a generous donation from fill in the blank. You could consider creating tent cards to put on the food or materials table at each of your sessions that acknowledges the donor's support. Or you may even want to consider an announcement at the beginning of each session or a slide if that's something that a donor is interested in, and your fundraising colleague would help you determine that. Some donors like to remain anonymous, but others love your institution and are really motivated to give by public recognition. So I'd like to share with you now this current example from one of our newest members, Presbyterian Hospital in Albuquerque, New Mexico. The medical education coordinator there applied to the hospital's foundation for funds to cover their initiation and membership fee. And the foundation chose to direct a portion of the unrestricted donations they receive to support the implementation of Schwartz Center membership. The image you see here is one she created to include in her email signature at the bottom of all of her emails, both to advertise the Schwartz Center rounds, which are going to be starting there this summer, and also to thank the Presbyterian Healthcare Foundation for making it possible. This is really a great example of what I just mentioned in terms of thanking donors in the publicity that you have for your upcoming sessions. And really, it's also another example and one more idea for you as a place to seek funding. If you are a larger organization that has a foundation attached to your institution, you may want to look into whether that could be a potential source of funds for Schwartz Center membership. Let's move now to discussing the costs of membership and working with your fundraising partner to determine what the true cost of membership actually is to your institution. How do you begin to discuss this, and what does an ask to your donor look like? There are a number of different ways to approach this, but let me start by sharing with you something that might seem odd, and it's somewhat unique to fundraising, but that is that bigger really is better. Usually, the bigger the number, the better a fundraiser's chance of raising those dollars. This might seem confusing, but the reality is that donors are looking to have an impact. A $5,000 or $50,000 donation may feel more impactful and better to a donor than a $500 donation, and thus they're willing to donate more or even make a stretch gift for them. It's really the psychology around fundraising and what I do every day. I really don't see myself necessarily as raising money. I am trying to help a donor express their passion and their caring for this particular mission, project, or institution, but to do it in a philanthropic and financial way. So I would encourage you to sit down with your fundraising partner and put together a broad brush budget that includes all relevant costs for membership. Your fundraisers will thank you for helping them to do this. Some of the related costs are here on screen that you may want to consider. The first would be the Schwartz Center membership and initiation fee, whether you're a prospective member and would be looking at the first year initiation fee, or you're an existing member and are looking for support for your annual membership fee. You'd want to include what your food budget is, whether you serve breakfast or lunch to the attendees. Are there any room fees for the auditorium or the conference room that you use at your institution? Are there any AV expenses involved? And you'd want to speak with your fundraiser to see if it makes sense to include staff time and create a comprehensive budget for Schwartz Center membership. What allocation of time is the physician lead, is the facilitator, and other planning committee members putting in to making membership and making the rounds possible? So I'd love to give you some examples from other sites to get the wheels turning in your head. I've seen annual sponsorships range from $5,000 to $15,000. It really depends on the size of the community that attends your rounds program. Some depends on whether you're a new member seeking funding for the first year initiation fee, or an existing member, as I mentioned, seeking support for the annual fee. And your fundraising partner can help you figure all of this out. But now let me tell you one example of Yale New Haven Hospital. It's a unique example, to be sure, but I'll share it anyway in case it does get your wheels turning. So our founder of the Schwartz Center, Kenneth Schwartz, attended Yale. And it turns out that one of the founders of the Schwartz Center back in 1995 also became the physician lead of the rounds at Yale New Haven, and he was also Ken's oncologist. The physician lead reached out to his development department, and together they put a budget together for annual sponsorship of the Schwartz rounds, and they came up with a number of around $10,000. But the donor that the fundraiser had in mind had the ability to do a lot more. So they requested a 10-year pledge to ensure that the Schwartz rounds and membership was there to stay. And the donor agreed. So this was a huge win for the rounds planning committee, who could rely on that money at least for the next 10 years. It was a huge win for the fundraiser, who essentially raised $100,000. And it was a huge win for the donor, who felt great about what he was doing. Yes, this is an unusual circumstance with all of these people knowing each other and being connected to our founder. But I share it because no matter where you're located, there is something about the Schwartz Center's mission and work that will resonate with someone. So now I would like to turn it over to our guest speaker, Louisa Nedkoff. Louisa is the manager of the Kilo Employee Wellness Program at Halton Healthcare in Ontario, Canada, a new Schwartz Center member. For context, Halton Healthcare is a multi-site healthcare organization that includes 3 hospitals with over 550 combined beds. It provides a wide array of inpatient and outpatient services to almost 400,000 residents. The organization includes over 4,000 staff, 305 physicians, and 1,500 volunteers. And collectively, it is supported by 3 foundations. Louisa is going to share with us how she went about securing funding for her institution's new Schwartz Center membership. Louisa?
Hi, thanks, Lisa. So let's move on to the next slide. Kylo, so as Lisa mentioned, I'm the manager of the Kylo Employee Wellness Program, and I know it's sort of a weird name, but it's a unique name because it is actually a pretty unique program within a healthcare setting. Kylo is an Indo-European word that means to be uninjured or whole. So as Lisa mentioned, we support a very large group of staff, physicians, and volunteers. We're stretched out over 8 different sites. So on the next slide, I wanted to point out around or explain the innovation fund that we applied for. So I've been listening for the last 20 minutes, Lisa, talk about approaching your foundation, and I came up with a rather unique way of getting the funding for our membership, and that's one of the reasons why the Schwartz Center approached me about being on the call today. In 2017, our organization launched its very first innovation fund, and it was because innovation is now one of the organization's 3 key strategic priorities. Our priorities are innovate, collaborate, and empower. The fund provided 2 categories of grants. One was a very small grant at $2,500 or less, and the other one was a larger one with a value of up to $10,000 maximum. Now, the reason why I actually was excited about being on this call is because I actually spoke to someone from another hospital in Toronto about how we actually got the funding for the Schwartz rounds, and they have had an innovation fund for many years, but never thought to actually apply to it. So in the next slide, how we actually started the process. I hadn't even heard of the Schwartz rounds. It was brought to me by Dr. Stephen Chin, who is the chief of our hospitalists, and he was speaking to me about assisting with their newly formed wellness committee. And it really was something that he mentioned sort of on his way walking out the door. This was just before Christmas. And he said, by the way, have you heard of the Schwartz rounds? Because he knew I was actually putting a proposal in for another proposal actually for the Innovation Fund. And he said it'd be sort of cool to, apply to the Innovation Fund to get some funding for that. And I'll be honest, I was so busy with this other proposal, I said to him, well, I'm not sure I'm going to have time because this is right between, literally just before Christmas, and the proposals had to be in January. And he said, but I'll send you the link. So Dr. Chin is really quick about stuff. So he sent me the link, and I took a look at it, and I was sold. So between Christmas and New Year's, I actually came in and wrote up their proposal, and then we won it. We were one of 7 proposals that did get accepted out of about 30 that were submitted, which was pretty amazing. So on the next slide, why Schwartz rounds? I'll tell you why this appealed to me so much and why I was so sold so quickly. Clinician burnout and compassion fatigue is a really big issue, as most of you know, within healthcare. And it's become pretty much an international epidemic. It isn't just within, Ontario hospitals. So I came across a recent study that said 1 in 3 healthcare workers were affected in Ontario, and this was a study of 4 Ontario-based hospitals. So I knew it was a problem. And I've been studying compassion fatigue actually quite a bit, but even more so over the last year to get my certification as a trainer. And one of the strategies that they really encourage to help prevent compassion fatigue and burnout is providing a forum for staff to discuss and process the difficult issues that they face in caring for patients and families. The benefit, it's been proven to reduce caregiver stress and isolation. It improves the communication and teamwork, and it helps caregivers better meet patient needs. So that is what appealed to me about this program, because it provides the perfect forum in a very structured and proven way of helping your staff debrief over the very difficult and emotional work that they do. So on the next slide, our core value is exemplary patient experiences always. And as caregiver experience drives patient experience, building engaged and resilient healthcare staff will enable an organization to provide the most compassionate, patient-centered care possible. That was one of the things that we constantly reinforced in our proposal, was if we do want to provide that exemplary patient experience always, it's going to be really critical that our caregivers are healthy and engaged and resilient. And my belief is that the Schwartz rounds is an ideal way of making sure that they are given the support to become that way. So I think that is me now. Over to you, Lisa.
Thank you so much for sharing your story with us, Louisa, and it's nice to hear your words about the Schwartz Center, so thank you. That is all things that we have found through the studies around the Schwartz rounds and our other programs, so it's nice to hear that that resonated with you. And I have no doubt that your funding story will spark some ideas for our listeners. Before I turn things over to Kim and we enter our Q&A, I just wanted to mention that I'm happy to speak with anyone offline who has specific questions or would like further guidance or some of the materials that I mentioned. Please do feel free to get in touch with me anytime. You can see my contact information on the screen here. Now, with the time we have left, I will turn it over to Kim so we can try to take some of your questions.
Thank you, Lisa and Louisa. Lots of great information. A reminder to our audience, if you have a question to submit, you may still do so. Just type your question in the questions pane and we'll answer as many as we can in the time remaining. So let's jump into some of our audience questions. Our first question, I believe, is for Louisa. Louisa, given the hat that you wear, any advice you have for other healthcare organizations listening who have an interest in Schwartz Center membership?
I think the one piece of advice I would give is every organization is always concerned about the bottom line. That's just the reality of healthcare. So I would definitely tie in your proposal with the financial impact, that it reduces staff turnover and absenteeism. So it's going to improve the bottom line. Compassionate care also reduces readmissions and lengths of stay, improving our clinical efficiency. I find that making sure you reinforce that the financial impact is a good way of getting the interest of your senior leadership team.
And I would just echo what Louisa just said. We've been tackling that at the Schwartz Center, you know, finding support for us as an organization. Personally, we've had to do what we call is making the business case for compassionate care. And we have some materials that we could share with members as well that we've put together to do that. If that's of interest, please feel free to reach out to me.
Great. Lisa, one of our audience members wants to know, do you need to wait to raise money until you've been a member of the Schwartz Center for a few years and can show a donor measurable results for your organization? Or can you raise funds before you even become a member?
That's a great question. You can definitely try to raise funds before becoming a member. As Louisa actually mentioned in her presentation, she did the work for me. She found some of our statistics and data that we have out there about the Schwartz rounds and our other programs. You can find a donor really based on our national metrics. We have over 20 years of running the Schwartz rounds program nationwide, and in the last few years now internationally. We collect evaluations from our member sites every year. And we've also conducted 2 independent evaluations of the program nationally. So we have data on the benefits of being affiliated with the Schwartz Center and hosting the Rounds program, as you've heard. And also, as Louisa mentioned, I'll piggyback on that, there is more and more research showing the benefits to providers and to patients for delivering and receiving compassionate care, and for providers, the benefits to being supported emotionally and psychosocially by their organization. So again, happy to share any of those materials with anyone who'd like to get in touch with me, but absolutely you can seek funding as a prospective member, not just as an existing one.
Thanks, Lisa. Another question, what is the typical cost of joining the Schwartz Center and starting rounds if you take into account the dues, the training cost, and dedicated staff to the project?
Sure. So the only fixed amount that I can share, because this really is individual to each institution, but the fixed amount would be the cost of the Schwartz Center fees. So for new members, the initiation fee is $7,500, which includes the first year membership as well as on-site orientation. And it's then $2,700 annually thereafter, beginning in year 2. So that's the fixed cost. Beyond that, I would suggest that organizations consider the staff time of 1 or 2 people who would be attending the on-site orientation and training that the Schwartz Center provides, the staff time of whoever comes together to be part of your Schwartz Rounds planning committee to get the initial one up and running, which maybe you would factor for or budget for 4 one-hour meetings for those people perhaps. And beyond that, there are the food and the other costs I mentioned to consider. But back to the question, really to get it up and running, it would be the Schwartz Center's fixed fee likely and the staff time as well. Louisa, do you actually have anything to add to that when you were putting your budget together for your proposal?
I was listening to you, Lisa. I actually only requested, because we only had $10,000 Canadian available. So once you do the translation of the fee of the $7,500 US, it's closer to 10,000. So one of the things that they asked me before they approved it is, what about the additional costs, the annual dues, and any other additional costs like food. They didn't factor in, and we didn't have to factor in staff time whatsoever. It was, people go to meetings here all the time. I mean, we're buried in meetings, so they didn't actually request that part. So I told the hospitalists that because this is employee wellness, that I would absorb the costs from that point forward for the annual dues of $2,700 US and the food initially, and that once we saw how well it took off and what were going to be our ongoing food costs, then we actually would approach the foundation to look at trying to get some additional sponsorship from donors, just to cover off the food. But I committed to actually doing the ongoing, covering the ongoing fee. And the one thing I would say there is a lot of HR departments have EAP programs, or occupational health might be another department that you could approach. So when I say HR has an EAP program, they're accustomed to spending money on supporting employees. So if you don't have an employee wellness program in place like we do, you might want to talk to your HR department to see whether they can set aside some funds, perhaps on an ongoing basis, to support the program. Maybe not the big, initial hit, but they might be able to help out.
Absolutely. Thanks, Lisa.
Well, it looks like we don't have any more audience questions, so I would again like to thank Lisa and Louisa for sharing their experiences and insights with us today, as well as everyone in the audience for setting aside time in your very busy day to participate. We hope you found today's session helpful and will join us for future office hours sessions. We know how busy all of you are, but we would very much appreciate your taking a moment to complete the electronic survey upon exiting today's program, as we value your input. Thank you all, everyone. Have a wonderful day.